I want to share with you an experience that I had yesterday. Before I came up here to the podium to make this address, there was a gentleman who was sitting in my office and had been sitting in my office for quite a while waiting to see me. I didn't have a chance to see this elderly gentleman before the brief, but when I went back, I called him in and spoke to him. And I asked him what it was that brought him there. And he told me, I have come here as a Kenyan. I have come because I want to give you a message as a leader in the ministry. I wanted to see somebody in leadership. He told me that when he came over to the reception here, he was asked, what is it that you want? He said, I want to see somebody in leadership. And he was asked by the guards whether he could tell them what the issue was. And he told them, no, I have this issue that I want to talk to one of the leaders. Anyway, he ended up in my office. And I asked him what the issue was. And he told me, I come from a place called Ruaka. I think we all know Ruaka towards on Limuru Road. And he told me, I came to you because what I'm seeing there worries me very much. I have seen that people have disregarded all the containment measures that have been put in place, and especially the containment measures regarding transportation and travel. And he told me the matatus there are filling up people beyond capacity, not following the measures, and that he was very concerned because he was in one of those matatus with his wife the other day, and they were both very worried. I was quite impressed, I must say, that I could see that this man had traveled far. He didn't seem like a person of means, but for him to come all that way and wait and give me this message, I felt it is important that I share it with Kenyans. And I told him I wish most of us as Kenyans were like you, that we were concerned and would do something about it. My appeal, therefore, again, is to all Kenyans, all of us, to take personal responsibility. We are at a very bad point as far as this pandemic is concerned. We are seeing the numbers rise. They will probably rise even further. We may be on that incline towards our peak. We have done the most that we can, and we'll continue to do that as a government and as a ministry to be able to contain that spread so that it does not overwhelm our health systems. But it will take more than that, and it requires personal responsibility by all Kenyans. At this particular time, we take that extra mile to protect ourselves and protect others, so that when those numbers come and the surge comes, our facilities will be able to deal with and manage those numbers that are sure going to rise of those people who will be looking for care in our facilities.